Your doctor calls you after a routine blood test and says, your ALT levels are elevated. You pause for a moment, unsure what that means. What is ALT? Why is it high? Should you be worried? In today's video, we're diving deep into a topic that many people overlook until it becomes a problem: elevated ALT, or alanine aminotransferase. If you're living in the U.S., chances are you or someone you know has had liver enzymes checked. And if ALT is high, it's a sign that your liver might be trying to tell you something. So let's unpack what causes high ALT, how serious it is, and what you can do about it. Let's begin by understanding what ALT actually is. ALT stands for alanine aminotransferase, an enzyme primarily found in your liver. Think of ALT as a worker inside your liver cells, helping process amino acids, the building blocks of proteins. Under normal conditions, only small amounts of ALT leak into the bloodstream. But when your liver is damaged or inflamed, those cells release ALT into your blood in larger amounts, signaling that something might be going wrong inside your liver. Now here's the thing: an elevated ALT level isn't a disease itself. It's a clue. It's your body's way of waving a red flag that your liver is under stress. In the U.S., more and more people are discovering they have high ALT, often during routine blood work. But what's driving this rise? What are the actual causes behind high ALT levels? Let's explore them one by one. One of the most common causes of elevated ALT in the United States today is non-alcoholic fatty liver disease, or NAFLD. This condition occurs when fat builds up in the liver of someone who doesn't consume much alcohol. It's strongly associated with obesity, type 2 diabetes, high cholesterol, and insulin resistance, all major issues in the American population. NAFLD affects nearly 1 in 4 adults in the U.S., making it one of the most widespread liver issues today. As fat accumulates in the liver, it causes inflammation and cell damage, leading to increased ALT levels. What's scary is that NAFLD often has no symptoms until liver damage is advanced. That's why an elevated ALT might be one of the earliest signs that something's wrong. Closely related to NAFLD is a more serious condition known as non-alcoholic steatohepatitis, or NASH. While NAFLD involves simple fat accumulation, NASH includes liver cell inflammation and damage. This can lead to scarring, fibrosis, cirrhosis, and eventually liver failure if not addressed. ALT levels can be significantly higher in NASH. Sadly, NASH is on the rise among both adults and children in the U.S., largely driven by poor diets high in processed foods, sedentary lifestyles, and rising rates of obesity. Another major cause of elevated ALT is alcoholic liver disease. Unlike NAFLD, alcoholic liver disease is caused by excessive alcohol intake. When you drink heavily and regularly, your liver struggles to process the alcohol efficiently. This leads to fatty buildup, inflammation, and liver cell death, which raises ALT levels. In fact, ALT is one of the markers doctors use to detect alcohol-related liver damage. It's important to note that chronic heavy drinking can lead to irreversible liver scarring, cirrhosis, and liver cancer. In some cases, even moderate drinking over long periods can damage the liver, especially if combined with other risk factors like obesity or viral hepatitis. Speaking of viruses, viral hepatitis, especially hepatitis B and C, is a significant contributor to high ALT. These infections cause liver inflammation and cell damage, often without any symptoms in the early stages. Many people in the U.S. live with chronic hepatitis B or C without knowing it, and routine lab work revealing high ALT can be the first indication of infection. If left untreated, these infections can progress to cirrhosis and liver cancer. The CDC recommends screening for hepatitis C in all adults over 18, partly because of how silently it can cause liver damage. Another underrecognized but increasingly common cause of elevated ALT is medication-induced liver injury. The liver is the body's detox center, processing everything from over-the-counter drugs to prescription medications. But some drugs can be hepatotoxic, meaning they can damage liver cells. One of the most well-known culprits is acetaminophen, also known as Tylenol. While safe in recommended doses, taking too much either intentionally or accidentally can cause severe liver damage and dangerously elevate ALT. Other medications that can increase ALT include statins, antibiotics like amoxicillin clavulinate, anti-seizure drugs, methotrexate, and certain herbal supplements. That's why it's so important to talk to your healthcare provider before starting new medications or supplements, especially if you already have liver concerns. Autoimmune hepatitis is another possible cause of high ALT, though it's less common. In this condition, the immune system mistakenly attacks the liver, causing inflammation and damage. Autoimmune hepatitis can occur at any age and affects women more than men. Without treatment, it can lead to cirrhosis and liver failure, but with proper management, outcomes can be greatly improved. High ALT is often one of the first lab abnormalities seen in autoimmune hepatitis, making early testing essential. Let's not forget about genetic conditions that can affect the liver. One example is hemochromatosis, a disorder where the body absorbs too much iron from food. Excess iron gets stored in the liver, pancreas, and heart, leading to organ damage over time. This iron buildup can cause inflammation in the liver and raise ALT levels. Another condition, Wilson's disease, causes copper to accumulate in the liver and brain. Though rare, Wilson's disease typically presents in childhood or young adulthood and often leads to elevated liver enzymes, including ALT. Certain metabolic disorders, like alpha-1 antitrypsin deficiency, can also lead to liver disease and high ALT. This inherited condition affects a protein that protects tissues from enzyme damage. When alpha-1 antitrypsin is defective or absent, it can accumulate in the liver, causing damage. Though this condition is more commonly associated with lung issues, it's an important consideration when evaluating unexplained ALT elevation. Infections beyond viral hepatitis can also play a role. For example, Epstein-Barr virus, the cause of mononucleosis, cytomegalovirus, and herpes simplex virus can all cause liver inflammation and transient ALT elevation, especially in children and young adults. These infections often cause flu-like symptoms, but the liver involvement may go unnoticed unless blood tests are done. Let's not overlook muscle damage as a contributor to high ALT. While ALT is primarily a liver enzyme, small amounts are found in muscles. When muscle tissue is severely injured, like in rhabdomyolysis or after extreme exercise, it can cause temporary spikes in ALT. That's why doctors sometimes check another enzyme, AST, which is found in both liver and muscle, to help determine the source of elevation. Now, let's talk about metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol levels. Together, these conditions significantly increase the risk of heart disease and type 2 diabetes. They also increase the risk of fatty liver disease and consequently high ALT. With nearly 1/3 of U.S. adults affected by metabolic syndrome, it's no surprise that ALT elevations are increasingly common. Celiac disease, an autoimmune condition triggered by gluten, can also lead to elevated ALT. In some people, gluten exposure causes not only intestinal damage but also liver inflammation. Interestingly, ALT often returns to normal once the person adopts a strict gluten-free diet. That's why some doctors screen for celiac disease when patients have unexplained high ALT. Pregnancy can also affect ALT levels. In certain conditions like HELLP syndrome, which stands for hemolysis, elevated liver enzymes, and low platelet count and intrahepatic cholestasis of pregnancy, liver enzymes, including ALT, can rise significantly. These are rare but serious complications that require urgent medical attention. It's crucial for pregnant individuals to have regular checkups to catch any such abnormalities early. Environmental exposures can play a role too. Exposure to industrial chemicals, solvents, or certain toxins can damage the liver and raise ALT. For example, chronic exposure to vinyl chloride, a chemical used in plastics, has been linked to liver disease and liver cancer. While less common today due to safety regulations, environmental toxins remain a concern in certain occupations or areas with poor air and water quality. It's also important to mention that ALT levels can vary depending on age, sex, and race. Men generally have slightly higher ALT levels than women, and ALT naturally declines with age. There's also variation across ethnicities, and what's considered a normal ALT for one person might not be ideal for another. That's why context matters when interpreting ALT results. One size does not fit all. Interestingly, some people may have elevated ALT with no identifiable cause, a condition called idiopathic ALT elevation. This doesn't necessarily mean there's no issue, but it does mean that current testing hasn't identified it yet. In such cases, doctors usually monitor the ALT over time, recheck related labs, and sometimes perform imaging or liver biopsy to get more answers. Now that we've gone through many potential causes of elevated ALT, you might be wondering, how do doctors figure out what's going on in your case? Diagnosis starts with a full clinical history, your lifestyle, medications, alcohol use, travel history, family history, and associated symptoms. Blood tests help rule out infections, autoimmune conditions, or metabolic disorders. Imaging like ultrasound or MRI can assess the liver's size and texture, and in some cases, A liver biopsy might be needed to examine the liver cells under a microscope. The good news is that many causes of elevated ALT are treatable or even reversible if caught early. For example, lifestyle changes like losing weight, eating a liver-friendly diet rich in fruits, vegetables, whole grains, and lean proteins, cutting out alcohol, and getting regular exercise can drastically improve liver health. If medications are causing the issue, adjusting the dose or switching to a safer alternative often solves the problem. And if an infection like hepatitis is found, antiviral medications can help control the damage. It's also important to note that just because your ALT is slightly elevated doesn't mean you're in immediate danger. Mild elevations can occur from something as simple as a viral illness or recent strenuous exercise. What's more concerning is persistent elevation or levels that continue rising over time. That's why regular follow-up with your doctor is essential. So, let's recap. High ALT is a signal, not a diagnosis. It tells us that the liver is under some kind of stress or injury. In the U.S., the most common causes include non-alcoholic fatty liver disease, alcohol use, medications, viral hepatitis, and obesity-related metabolic issues. But other conditions like autoimmune hepatitis, genetic diseases, celiac disease, pregnancy complications, and even muscle injury can also lead to ALT elevation. The takeaway? Don't ignore an elevated ALT. Work with your healthcare provider to find out what's causing it. The liver is one of the most vital organs in your body, and thankfully, it's also one of the most resilient, capable of healing itself when given the right conditions. Early detection and lifestyle changes can make a big difference in protecting your liver for years to come. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more in-depth health content like this. Have you or someone you know dealt with high ALT levels? Share your story in the comments. Your experience might help someone else. And remember, your health is your wealth. Take care of your liver, and it will take care of you.